There are two categories of women with hypoactive sexual desire disorders who are menopausal. The first category is the one who have surgical menopause where the ovaries have been removed. Now, as long as there's no contraindication to hormone therapy, they will benefit along with regular hormone replacement that we give till the age of menopause. We add a small dose. And remember, in women, the levels of testosterone that are required are 1/10 of what are in men. So whatever, there are no testosterone preparations available in India that are designed for women. So whenever you use any preparation, you have to use 1/10 that dose that you would use for a man. The other category is women with hypersexual desire disorders who are menopausal. So which means they don't have periods, but they still have uterus. They have their own ovaries. There's no surgery involved. In these women, testosterone does work to improve sexual desire, but it will only work on the background of estrogen. So without correct estrogen replacement, you will not get the benefit of testosterone. So there is no point in just giving testosterone for desire disorders. So if you remember the slide I showed, I pointed out particularly that when you look at desire or you look at arousal, the main feeding hormones, you need estrogen. Even DHA is a precursor. All other hormones are derived from DHA. Cortisol pathway is again derived from cholesterol. From cholesterol, androstenedione, DHEA. From there you get testosterone, progesterone, estrogen. So both these things are important. If you just give testosterone, it just boosts cortisol and you get more masculinizing effects. If you give estrogen properly, then you get the benefits of arousal and desire. I have used testosterone implants as well in the UK. We used to give for postmenopausal women with desire disorders pellets, estrogen as well as testosterone. Later on, they were removed from the market because of masculinizing effects.